John Mahama is in Tepa as we speak in the Ashanti region, continuing his tour with 29 days to go to the December elections. Ohiming Tewia is following him for us. He joins me now on the line. Ohiming, good afternoon to you. Good evening to you. What's happening? What's he talking about today with 29 days to go to the elections?
Yeah, good afternoon, Frank. Today is also another busy day for President John Mahama and his team. First, in the morning,
and what is he talking about today? As in, where has he been today as part of his campaign tour?
Who says that.
All right. I'm struggling to hear Ohiming Tewia. We'll try and raise him back on the lines and see if we can get a clearer connection, because we know that the president has been in the Ashanti region. In fact, from over the weekend up until now, he has been speaking to the electorates there. They are targeting some 13 seats in the Ashanti region. You know that for the NDC, for the 2016 elections, they've targeted some 1.5 million votes for the Ashanti region. You'll recall that in 2012, their performance had been appreciable considering the seats they were able to win and the performance over the years. They're looking to break the stronghold of the MPP in the Ashanti region. Furthermore, we know that Aswase is one of those seats being really pushed by really being pushed for by the MPP, and we know that the majority chief whip Alhaji Muntaka Mubarak is the one holding the seat. We know the president went there over the weekend asking the electorate there to vote and continue to stay with the NDC, first for their parliamentary candidates and also for the president. He retained President John Mahama in this year's election. That's the call by the president to the people in the Ashanti regional constituency of Aswase. We'll reach Ohiming Tewia on the line shortly to give us an update on where he has been today. Tepa is one of the areas we're learning he's been to, but we're trying to understand what is in his narrative. With 29 days to go to the elections, what are some of the things he's talking about to convince the electorates, those who are undecided, those who are on the other side, not seeking to vote for him, what he's telling them different that will make them change their minds and switch to his camp. Remember that with some 29 days to go, it's now about selling your message the best way to convince anyone to vote for you across the country. And Ashanti region has been the target of the NDC for over the years. This year is no different. We'll bring an update with Ohiming in just a moment. But as you can imagine, with 29 days to go, the candidates have been crisscrossing the country in a bid to win the hearts and minds as we prepare feverishly for the December 7 elections. You're still watching The Pulse on the Joy News channel on Multi TV. As I mention all the time, your views and comments are welcome via social media at Joy News on TV, on Facebook, and on Twitter. While we're waiting, get your Ohiming on the line from the Ashanti region. Also check out what's happening on the campaign trail here in Ghana. Let's quickly do an update on what's happening in Uncle Sam's country, America. The American elections is just less than 48 hours away till we know who wins that election. The fear of racial discrimination and mass deportation is galvanizing many Ghanaians living in the United States with the right to vote to turn out in their numbers to vote in tomorrow's crucial polls. Head of our political desk, Evans Mensah, who is covering the elections with support from the U.S. Embassy and the International Center for Journalists, traveled to Iowa City in the United States to meet up with members of the Ghanaian community. Watch his conversation with the two community members.
You know, I'm very much concerned. I haven't, given up my identity as a Ghanaian yet, but I'm very concerned because whatever happens to America indirectly happens to a lot of countries, including Ghana. So for me, I'm much concerned, and particularly because of the fact that I live here, So I'm following this election very carefully. Having said that, I think that it's unfortunate with the process that is happening right now. We have, of course, in this day and age where we have a lot of, hackers around, we have a lot of cameras around that literally whatever you do, you think you're doing it in the darkness, but it's out there. And we have people outcry, people, saying that we want this particular person, and we have voter suppression, all these things happening, it would have been a different story if all these things didn't come in the limelight. But with these things coming in the limelight, for me, and with America priding itself as a super, power, I think it's, it's going against them. It's all these things are working against America.
Now, let me ask though. So we all know their challenges. I think that you admit that this year's election has brought the worst out of America. I think that is a way to put it. The way you. So who are you going to vote for?
I'm not going to tell you who I'm going to vote for. I'm not going to tell you, but let me just put it this way. Let me use my demographic, the demographic in which I fit, to help you draw your own conclusions. I am a black man in the U.S. I'm well educated. I have lived in blue states all my life, if you will. I think that's enough.
Blue states, by the way, are states that traditionally always vote Democratic. In other words, they've always voted Obama. They are expected to vote Hillary. And he's always lived in those states. He's a black man. Black people in America associate with the Democratic Party. So our conclusion is...
well, obviously he's going Hillary.
Who knows?
That's pretty obvious, isn't it?
Say it, I said it.
Yeah. And he agrees. You agree, right?
I'm just, the demographics in which I fit.
So we are drawing our own conclusions then.
Please feel free. That is what I wanted you to do, right?
So views may vary on this, but there's still more to bring you from the American elections. Meanwhile, representative from the Communications Department of the Johns Hopkins University at Arkansas in the United States, Dr. Marquita Smith, tells Joy News that black communities have a legitimate concern regarding immigration should Donald Trump win the election.
There's about 190,000 Ghanaians, according to the 2013 census, who live in the United States. And 190,000 people can definitely be a force in making a difference in terms of states across the U.S. And so I think that they have some very valid concerns, and I'm not surprised that they're being galvanized to go out and vote tomorrow. I'm very excited to hear that from Ghana, but it's a substantial population, and they can indeed have an impact. And that's just Ghanaians alone. We're not talking about Nigerian Americans or people from all over West Africa and all over the continent, but just Ghanaians alone almost number 200,000. And that's a significant number of votes.
So let's see. Immigration and other issues will influence people's votes, but we know that over the weekend for Hillary and for Trump, the talking point about emails as against immigration are beginning to become the biggest talking points with less than 48 hours to go to the elections. We'll speak to Evan Spencer via Skype after the short break. But after the break also, we will spend some time at the Accra Psychiatric Hospital. It's beginning to look like this matter will not walk away anytime soon. Yes, the government promised to bring what is needed for them to work, but it's looking as though they brought too little, and the nurses say they will not return to work anytime soon. Details after the break. Stay with us. You're welcome back to the Pulse on the Joy News channel on Multi TV. Now, nurses at the Accra Psychiatric Hospital say they will continue the strike despite the release of an amount of 30,000 cedis and some medication, 300,000 cedis and some medication to the hospital. You'll recall that nurses at the hospital embarked on a strike, citing unsafe working environment and inadequate medical supplies as reasons for their decision. The Health Ministry released the monies last week after the strike, but the spokesperson of the nurses, Philemon Inning, says only 7 of the 12 types of medication needed for the patients have been supplied. Hence, they will not get back to work.
One of the triggering factors of the strike here at the Accra Psychiatric Hospital by some nurses has to do with the issue of inadequate medical supplies. Nurses here at the hospital say patients who have been brought to the hospital are relapsing into the old condition that they were in before they were brought to the hospital. Some of them have become aggressive as a result of that. 2 nurses here at the hospital have been attacked by some aggressive patients. Government says it has released an amount of 300,000 Ghana cedis to mitigate the effect of the situation here at Accra Psychiatric Hospital. Drugs amounting to 120,000 Ghana cedis also been released to Accra Psychiatric Hospital. But nurses here say they are not backing down on their decision to go on strike. They are saying that even though government has made some effort, that effort is not enough. Philemon Ainen is the spokesperson for the psychiatric nurses group here at Accra Psychiatric Hospital.
The current situation is that the nurses are still resorting to safety. That is, they have not come back to the various wards, or they've not been back to post. And why are we not back to post? We are not back to post in the sense that we were told, like you rightly said, that government has procured some medication worth 120,000 cedis. Yeah. We, as executives of the psychiatric nurses group, went to the pharmacy unit to inquire whether or not the claim by the ministry was true. Then upon getting to the pharmacy unit, we realized that they had requisited for 12 different kinds of medication to last for the 2 months, which was agreed at the National Labour Commission hearing. Then out of the 12 medication they had requisited, they had only received 7 different kinds of medication. And even out of the 7 medications, it was only 2 of them which could last for a period of 1 month.
Anxiety best describes what is going on within the 4 walls of the Accra Psychiatric Hospital. But the combined anxiety of the families and relatives gathered there would not save the day, as some patients have been brought to the hospital, but nurses will not attend to them because they're on strike.
Me free asante fijase enura eno omo kra me say me bayadan fo be kra me say me ba ne take asafoforo wa nasum.
I am from Asante Fijase. I got a call yesterday that my son was experiencing auditory hallucination.
Ene me free Fijase ho abba sameba nam de na ko hospital ena me de na ba scientific hospital ha almost say almost no more strike.
I came all the way from Asante Fijase, but they say the nurses are on strike.
Bepa chose say me to hokra ka prekure binkuta me say me ho chire me to suana mi su minisika.
I don't have any money on me. I have just been crying. Where else should I take him?
Me bedru ha no mo I am say me sanfa no ko pantai e fan biem na me fa say ska kura me de yalo fa no kura minibi.
One of the many measures taken to mitigate the effects of the strike by the psychiatric nurses group is the repatriation exercise. Authorities here contend that some inmates in here at Accra Psychiatric Hospital are mentally stable to reunite with their families. After various checks, about 20 of them are ready today to reunite with their families. So how long have you been at Accra Psychiatric Hospital?
13 months now.
13 months?
Yes.
And now they are taking you back to reunite with your family, with your family?
Yes.
Are you excited about this?
Yeah, I'm excited to leave, to go and see my family and everybody.
Actually, I have been through a lot of lockups, but I think this is my final going home, so I'm very happy.
What's the experience like here, living here?
Yeah, it's a wonderful experience. Actually, I never had information about the psychiatric hospital. I was in the United Kingdom 2005-2007. So it was there that I started having information about the psychiatric hospital because I slept in one of the hospitals there. But long ago, I knew of Accra Psychiatric Hospital. I saw a patient walking, begging money to do some drugs. So it was later that I found myself here, that I got information about how the patients are treated, how the nurses handle them, the food they eat, and everything that they do.
Reporting from the Accra Psychiatric Hospital, Maxwell Agbagba for joining you.
Well, let's get some more on the story. Tony Goodman is the communications director, head of public relations for the health ministry. He's joining us now online. Mr. Goodman, thank you for joining us. Mr. Goodman, good afternoon. Thanks for joining us. Mr. Tony Goodman, can you hear me? Good afternoon.
Good afternoon.
Okay. It seems Mr. Goodman can't hear me. We'll try and raise him on the phones again and get some more details on this particular story. But because we know that in the last hour or two, the health ministry had sent some information to the nurses indicating that whatever they asked for, they are about to be given. And so let's see what has changed in the last 2 hours. Tony Goodman speaks for the health ministry. Mr. Goodman, thank you for joining us.
My pleasure.
Right. So,
okay.
As regards the concerns of the nurses, have they been resolved this year? Because we're learning that the nurses say they will still not return to work.
Thank you. Yes, we've resolved their issue. We've actually supplied medication with 153,000 Ghana cedi. We've also given them 300,000. This morning, we've added some detergents to it, even though we've given them the money to buy some of the things they want. We've given them some detergents today too. We are looking at supplying them some items more because we just spoke to the management in the minister's office who said they are going to now communicate to their members or their staff that they now have enough that can last them through. The minister assured them that...
Sorry, Mr. Goodman. Enough that can last them for how long?
For now, enough that can last them till December. But
till
the
December.
Minister has assured them, the minister has assured them that he's going to make sure that they have enough supply that can take them from now to the end of January. So that was a discussion held. Most of the things have been donated or have been presented to them. So we've moved away from where they didn't have anything at all. As I speak, have enough to take care of patients.
Okay. Now, speaking to them today, the concerns they raised were that for the drugs you brought, you are supposed to bring at least 12 of the medications. You brought only 7. That's one of the reasons they give for not returning to work.
My brother, we've never had all medication in any facility before. Obviously, when you are procuring medication, there are some that may have to go through some process. What is more important to them is to go to their management and listen to what is happening. You see, the management is satisfied, staff is not satisfied. We've not heard this anywhere before. What is more important is for you to go to management, ask what is happening. Have you received money? Yes. Have you received medicine? Yes. Have you been given detergents? Yes. Have they promised to give you more? Yes. What was the agreement when we went to Labour Commission? Has the ministry fulfilled all the agreements? Yes. So, you see, let's not shift go post as and when we feel that we've fulfilled one obligation or the other.
I get that point, Mr. Goodman. But one last thing I need understanding on is the important matter of the food supplies. What you provided for them, what element takes care of their food and for how long? What kind of cover do they have on them?
My brother, we don't have problem of food in Accra Psychiatric Hospital. The issue we got was they have enough food, but they don't have protein. So quickly we had to add fish. We add fish to it because they needed this tuna and all that. Quickly we have to make sure that we send some to them. So with the food, we've dealt with it. Medication, we've taken care of it. Money, we've dealt with that as well.
Okay. Now, apart from that of the psychiatric nurses, we know that there are other issues to do with the Ghana Registered Nurses Association. They indicated to us here on the show last week that if their concerns are not met, they will embark on a strike. In fact, they did earlier this morning. We know you've been meeting them. What's the outcome of that meeting?
Yeah, before our meeting today, we actually asked some of our agencies to meet them because most of the issues they mentioned have to do with our agencies. There are several meetings they've held. Today, we met them to also trash out some of the issues. But before then, we had a letter from the National Labour Commission telling us that by Wednesday we have to attend upon them and nobody should declare any strike, nobody should wear red band. So in this meeting, we were able to trash out the various issues they raised. In that meeting was the Minister for Employment and Labour Relations, Honorable Haruna, the Minister for Health himself was there, the Deputy Minister for Health was there. From their part, we had the President of GRNMA, the Secretary, and then the Treasurer. We had other directors who were also part of that to see to some of the things they mentioned. We've actually dealt with most of their issues. And even before the meeting, our agencies dealt with some of them. When we talk about arrears, the Controller and Accountant General told us clearly that he's inputting about 9,000 for this month's salary. He's also doing we've received another 2,000 from the Auditor General. Another issue they raised is payment of promotional allowance. They want to stop. They don't want to pay again. Yes, we said yes, they are right. Because in the collective bargaining certificate or agreement, we've agreed that institutions should pay, not individuals. So that communication must also be clear to institutions. They must pay. No worker is supposed to pay interview or promotional interview fee. That was also communicated to them. They said we should employ some graduate nurses who have completed. Yes, we've showed them document that we've actually given it to finance. They've indicated that they are going to give us the financial clearance, and it will take effect from January 2017. Because if they should give us the financial clearance today, it will expire by the end of the month, and we may not be able to go through the registering and all postings you have to do. So they said 2017 to take effect. So we are grateful to finance. Some of the issues they dealt with, like the Tier 2 pension scheme, is being dealt with at the TUC level. So the Minister for Employment and Labour Relations mentioned that he's even going to have that meeting with them. So all the issues are things that we can negotiate. We have to also meet with them and discuss, and not to declare strike actually.
Okay, I get that point. But one small matter, Mr. Goodman. What's the rationale, first of all, and it's been happening before you said, yes, it's wrong, it should not happen. But why should that practice even be in existence in the first place of having...
Which practice?
Of having these nurses pay for promotion interview?
It's been there since. And we all agree that it's not right. So we included it in our bargaining, collective bargaining discussions. So it was left for the institutions to take that up. It's been there. It didn't start today.
What does it say? I mean, what does it do? That amount of money they pay, 100 to 160.
According to their employers, the Ghana Health Service and Co., they said because they have to pay some panelists, they have to pay some people. But we are saying in the ministry that it's not right. So it's not even a non-starter. That is why we've been able to include that into the bargaining agreement. So that is also even not a point for us.
All right, Mr. Goodman, thank you for your time. We'll see what happens between now and tomorrow, especially for the nurses at the Accra Psychiatric Hospital, hoping that they will return to work, in fact, with their concerns dealt with, so we don't see the problems we recur in the future. Right, so that's for issues at the Accra Psychiatric Hospital and issues to do with the nurses. We're learning that the issues have been resolved. Let's hope that this brings finality to this case. We'll try and also speak to the nurses and find out if indeed these interventions by the Health Ministry brings closure to this matter or not. Time to bring you our lesson today from the voting school, and it's about those who are visually impaired. How are they helped out on voting day? Details in today's lesson.
A disability may range from being visually impaired to being unable to walk, but a disability should not be a reason to be denied the right to vote. The framers of the law anticipated this, so the Public Elections Regulations CI 94 tasks the presiding officer at the polling station to ensure an individual can vote no matter their disability. The law says, quote, the presiding officer shall on request permit a voter who is visually impaired or physically challenged to be assisted by a person of the voter's own choice to vote in a manner different from voting procedures specified in these regulations. Where the presiding officer accepts the request of the voter, the officer shall record in the register opposite the name of the voter who was assisted and the reason for the assistance.
That's our lesson today from the voting school. Bring you this every day till December 7 when you head to the polls to take a decision on who you vote for come December 7.